India has expanded its vaccination drive as it struggles with huge numbers of COVID cases. But there were immediately problems with that effort. It has become the first country to report more than 400,000 new coronavirus cases in a single day. Freelance reporter Ishan Garg has more from New Delhi.
India has recorded more than 400,000 cases of COVID-19. That's the highest tally anywhere in the world. Now, while India is suffering from a massive surge in infections, it's also trying to ramp up its vaccination drive. The government says that the only long-term solution to beat the pandemic is going to be vaccination. But the plan is already in trouble. 20 out of 29 states in the country are saying that they are not ready to cope up with the government's plan now. The city of New Delhi, the capital of the country, the Chief Minister of the state has said that people should not queue up to vaccination centers because the city does not have the doses simply. The Chief Minister says that they are in touch with the vaccine manufacturers, but the shots have not been delivered yet. Now, experts are saying that this is because the government has mishandled how it should have communicated the demand through the vaccine makers. When India's immunization program started, the idea was to inoculate 300 million people by August. But now suddenly in the middle of the drive, the government opened it up to more than 1 billion people. That's all adults in the country. Experts are saying that this is not the kind of demand that the vaccine makers, which of course are one of the biggest in the world, will not be able to cope up with this sort of demand. But while there is doom and gloom on the vaccination front, there is hope on the help coming from several countries, US, UK, Hong Kong. They're all sending medical equipment to India's way. And at the same time, Sputnik V, the vaccine from Russia, is also arriving in India today. Now, experts are saying that all of this is necessary and important to curtail the pandemic. But what's more important is to impose a nationwide lockdown. If not a nationwide lockdown, at least movement restrictions on movement in urban centers, especially where there's high population. All of this comes at a time when Prime Minister Narendra Modi has been holding back-to-back meetings with his officials, and the government says that they hope to have a handle on the pandemic in the next couple of months, because experts say that situation will actually be worse in the next 2 months when India will be recording more than 800,000 cases every single day. That will stretch India's healthcare system even further and deepen the crisis even more. Ishan Garg for CBC News, New Delhi.